Hello, sir. Good afternoon. My name is Ralph Ignacio. I'm going to be your nurse today. I'm going to be performing a head-to-toe assessment on you. Is that okay with you, sir?
Yes, sir.
Okay, so before we start, I'm going to go ahead and check your wristband, sir. And can you please verify your name and your date of birth for
It's
me?
gonna be Ramiro Salinas, 83186.
Okay, thank you. And before we start, I just want to ask some questions. Do you know why you're here, sir?
For an assessment.
Okay, do you know where you're at?
Yeah, I'm at the clinic.
Okay, do you know the time it is?
Time, it's, I guess we're Friday.
Okay. And then
That's
do you know who the President of the United States is, sir?
Yeah, it's gonna be Joe Biden.
Okay, all right, thank you, sir. And then, since we're not doing vital signs, your vital signs are checked already, and you have a pain rating of 0 out of 10.
Mm-hmm.
All right, sir, thank you. All right, sir, so to start off the assessment, I'm gonna go ahead and start checking your head first, sir. So I'm basically trying to see any symmetry. Your head is symmetrical, eyes are level, ears are leveled as well, head size is proportion with your body. While I'm here, I'm usually supposed to check cranial nerve number 7 already, but due to COVID restrictions, I'm very limited on what I can do with that. But usually I would ask you to smile, I would ask you to frown, puff your cheeks, push your lips, but I could see if I can see you close your eyes, sir. Can you perform for me and open it? All right, sir, thank you. Okay, after this, I'm gonna go ahead and palpate your cranium, sir. But first, I'm gonna don on some gloves. Step in the stool. I'm gonna go ahead and start palpating, sir. So basically, I'm checking for any masses, any lesions, any kinds of infestations, which I don't see any. No masses, no indentations. Very good hygiene. Okay, let's see with that. I'm gonna go ahead and don up my gloves now. And hygiene. All right, sir, I'm gonna go ahead and palpate your temporal arteries. Let's see, okay, it's a 2+. Next, I'm gonna go ahead and assess your cranial nerve number 5, sir. That's your you're checking for your masseter. Can you go ahead and open your mouth, sir? Close your mouth. And I'm gonna check your resistance. I'm gonna put pressure here by your chin. Can you open your mouth, sir? Can you close it? Okay, thank you. And I'm gonna palpate your temporal mandibular joint, sir. Can you open your mouth? I'm gonna see if there's any cracking, any crepitus. Close it, sir. Okay. And lastly, I'm gonna palpate your sinuses, sir. Starting off with your maxillary sinus. Do you feel any tenderness, any pain when I put pressure?
No.
Okay, I'm gonna go to your frontal now. Any pain, any pressure,
No.
tenderness?
No.
Thank you, sir. All right, sir, after palpating your sinuses, I'm gonna go ahead and inspect your eyes. To do that, I already have my gloves on. I'm gonna go ahead and check your pupils, check the color of your sclera, making sure it's wide, checking the positions of your eyeballs, they're in the right eye socket, looking for any discharge in your lacrimal. Next, I'm gonna go ahead and pull down your eyelids. I'm gonna check to see your conjunctiva, making sure it's nice and pink, which they are. Thank you. Next, I'm gonna go ahead and perform cranial nerve number 3 test, but I'm gonna go ahead and dim the light first, all right, sir? Sir, I'm gonna go ahead and have you stare straight across over there. I'm gonna shine the light. I'm gonna check your right eye first, your right pupil, making sure it constricts. I'm gonna go ahead and go to your left eye now. Same thing. Eyes, pupils, constrict. All right, sir, thank you. Go ahead and dim the lights open, okay? All right, while we're here, we're gonna check your cranial nerve number 6. So I would just need you to follow this pen for me, all right, sir? We'll start from here. checking your 6 cardinal field of gaze. Good. Right here. Here. And lastly. Alright, sir. Thank you. Now we're gonna go ahead and check your cranial nerves number 4, and that's your accommodation and cover test. So for the cover test, sir, I'm gonna have you, can you cover your left eye for me, sir? I'm gonna do the same. Now I'm gonna put out a number and you can tell me what number it is, okay, sir?
2.
2, okay. Can we repeat on the other eye? Can you see what number?
4.
4, okay, thank you. Accommodation. Next, I'm gonna go ahead and check your cranial nerve number 2. And that's, since we don't have the equipment, I'm gonna pretend the pen light is my ophthalmoscope. So usually I would inspect your right eye with my right eye. Now go ahead and shine the light with you, checking for the blood vessels, your red reflex, your optic disc. And I'm gonna go ahead and perform on the other eye. Okay, checking the C. Okay. Okay, what's next, sir? I'm gonna have you look at a Snellen chart, sir. I'm gonna go ahead and remove this real quick, okay?
Mm-hmm.
Can you stand right there for me, sir?
Yes, sir.
So a Snellen chart, I'm gonna have you 20 feet distance from the Snellen chart, sir. We're gonna first perform your left eye. Can you cover your right eye, sir? All right, sir. Look ahead, straight ahead at the Snellen chart. What's the smallest line that you can read for me, sir?
I think number 8.
Okay, sir, go ahead.
It's gonna be DEF POTEC.
Okay, very good. Go ahead and switch it to the other eye. Same thing. What's the smallest line that you can read, sir?
Number 8. It's gonna be DEF POTEC.
All right, sir. Now can we do it with both eyes?
Okay. Number 8 again. It's gonna be DEF POTEC.
Okay, very good, sir. And then lastly, we're gonna do, I'm gonna have you read something to check your nearsightedness, sir. Can you read this paper for me, sir?
My name is Ramiro Salinas.
Okay, thank you. Lastly, check for your accommodation, sir. Can you look at this pen right here?
Mm-hmm.
Can you follow it? All right, sir, thank you. So after checking your accommodation, I can now say your eyes are past the Perla test, which is your pupils are equal, round, reactive to light, and they accommodate. So next, sir, we're gonna go ahead and inspect your ears. So to do that, I'm gonna go ahead and don on gloves again. Alright, sir, before I begin, do you have any pain inside your ears? No?
No.
Okay, I'm gonna start first on your external ear. I'm gonna check your auricle, making sure there's no lesions. Do you feel any pain there, sir?
No.
No? I'm gonna go press on your tragus. Any pain, sir?
No.
This ear, no pain. I'm gonna go check your mastoid process, which is right here behind the ear. Any pain, tenderness when I touch it, sir?
No.
No? Okay, thank you. Now I'm gonna go ahead and inspect it with an otoscope, sir. I'm gonna start off on your left ear. To do this, sir, I'm gonna go ahead and pull your ear up and then back. It's there with my otoscope, looking at the cone of light, which on the left it should be at 7 o'clock. I'm gonna go ahead and do it on the right side. Same process. Pull the ear up, back, inspect it. Cone of light should be at 5 o'clock, which it is. Just put this back. Alright, sir, we're gonna go ahead and perform cranial nerve number 8 assessment, sir. And I'm gonna start out with the whisper test, sir. So can you cover your other ear with the tragus? First, let me don off my gloves first. And hygiene. Cover the left ear tragus, sir, and then I'm gonna go ahead and whisper 2 words, sir. Can you tell me what it is?
Apples, bananas.
Okay, sir. Can you repeat that with your other ear? Can you cover the track as your other ear?
Red, blue.
All right, sir. Next, sir, I'm gonna perform the Weber test and the Rhine test. Okay, sir. So to do that, we're gonna use a tuning fork. So the Weber test, I'm gonna hit the tuning fork, sir. You're gonna tell me. You're gonna hear a buzzing sound. You're gonna tell me if you hear it better in your left ear, your right ear, or between the midline. Where do you hear it better, sir?
Both.
Equal.
Equal.
Okay, thank you. So you passed the Weber test. Up next is gonna be the Rhine test, sir. So here I'm gonna test your air conduction versus your bone conduction. All right, sir. So first, let me perform it on your right ear. You tell me which position it is better in. Okay, it's either position A or position B. So position A. Position B.
A.
A. Okay, I'm gonna repeat that to your other ear. Position A. Position B.
A.
Okay. All right. Thank you, sir. And then to conclude that, I'll go ahead and test your Romberg, the Romberg test, sir. I'll have you stand up again one more time, sir. Shoulder width apart, feet. Can you put your hands up? Just straight, stare straight ahead, sir. Looking for any signs of swaying. No signs of swaying. Side to side swaying. Front and back swaying. Push them a bit. All right, sir. Perfect. Thank you. Okay, you can go ahead and sit down now, sir. Put this back. Okay, so after the ears, usually we inspect the nose and the mouth, but due to COVID, there is some restrictions, so I won't be able to perform cranial nerve number 1 test, which is your olfactory, your sense of smell. So usually what I would do is I would ask you to occlude one of your nostrils, and I would tell you to close your eyes, and I would place a scent by your nose, and you would tell me the scent of it, and then I would repeat that with your other nose. Okay, and I would also inspect your mouth. I would have you open your mouth, inspect your lips, inspect your teeth, your oral mucosa, your uvula, which we can do right now. And I would ask you to breathe through your nostrils, see if you can breathe perfectly, stuff like that. And for your mouth, sir, usually we test cranial nerve number 12, which is where I have you stick your tongue out, and have you press it against a tongue depressor to make sure, to check the strength of it. Also for cranial nerve number 9, I would have you say ah, and I would use a tongue depressor to check your gag reflex. And lastly, cranial nerve number 10, to test for that, I will have you take a sip of water to see how you swallow and if you use any accessory muscles on that. And that is it for inspection of nose and mouth, if we were able to do it. Thank you. All right, sir, so after inspecting your mouth and nose, I'm gonna go ahead and inspect your neck, sir. I'm looking at any discoloration, your skin is tan white, any abnormalities, any lesions, which I don't see any, good skin color. So while I'm here, I'm gonna inspect your cranial nerve number 11, sir. Can you move your head side to side? Up and down? Right, sir. Can you shrug your shoulders? Very good. While I'm here, I'm gonna inspect your lip notes. I'm gonna start off here first. Auricular. Any tenderness? Tell me if you feel any tenderness.
No.
Any pain? No. No pain. Going down around the neck. No tenderness, no pain, sir. All right, sir. I'm gonna go ahead and inspect your palpate your trachea. Any tenderness?
No.
Okay. I'm gonna go ahead and palpate your carotid artery, sir. Meanwhile, checking your pulse as well. Okay, 2 plus on this side now. 2 plus. All right, sir. I also want to check if you have any jugular distensions. Can you turn to one side, sir? Okay, the other side now, sir. Okay, and then The last thing I would do is I would auscultate your carotid arteries, alright, sir? I'm gonna use the bell. Make sure it's warm. Breathe in, breathe out for me, sir. Hold it in. Okay, other side. Okay, thank you, sir. All right, sir, moving on from the head and neck, we're gonna go ahead and go down to your check. I'm gonna inspect your skin of your upper extremities, checking for any signs of lesions, any cuts, any types of abnormalities, which I don't see any. Your elbows, okay, your skin color, which is tan and white on this side. While I'm here, I'm gonna go down and palpate your radial arteries bilaterally. I'm gonna go ahead and do that. Okay, both are bounding, 2+ in perfect rhythm. Okay, checking the palm of your hands now, checking for lesions. I do see some signs of calluses, but overall, perfect hand condition. Now, flipping that now, I'm gonna check your skin turgor. So I can check for right here. Goes back to normal, less than 2 seconds. Less than 2 seconds. Moving down, sir, checking your fingernails. And go and check for any abnormalities, any clubbing, any signs of cyanosis, stuff like that. Which they are in good shape. I'm gonna check your capillary refill. First on this hand, less than 2 seconds. Other hand, less than 2 seconds. All right, sir. That's it for the skin right there. I'm gonna go ahead and jump to your chest, sir, and check your anterior. Usually, are you comfortable with taking off your shirt, sir?
No.
No? Okay, so usually I would have the patient take off his shirt, but since you're uncomfortable, that's fine. What I would check though is checking for chest expansion every time he breathes, making sure if it's labored or non-labored, if he uses any accessory muscles. I would also check the diameter of his chest anteriorly and posteriorly, just to see if there's any signs of barrel chest, which we see in people with COPD. After inspection, sir, I'm gonna go ahead and auscultate your chest, sir. With my stethoscope. First, I'm gonna be using my diaphragm, and I'm gonna be inspecting on 5 points. So the first point is gonna be located by the right sternal border at the second intercostal. That's gonna be my aortic valve. Then across that is gonna be my pulmonic valve. Then moving down, one intercostal down is gonna be my Erb's point. Moving down to the fourth intercostal, that would be my tricuspid valve. Very good. Then lastly, I will move to the mitral valve, which is at the midclavicular fifth intercostal space. And this is also where I will find the apical pulse, where I can check for his pulse. So after using the diagram, sir, I'll go ahead and use the bell. Same process, same positions. Then last position. Thank you. All right, sir, so moving on from your chest, I'm still gonna be inspecting you anteriorly, assessing your lungs. So it's the same thing, basically. I'm inspecting to see if you have any lesions on your chest, your breathing, if it's labored, non-labored, any signs of accessory muscle movement. After that, I can go ahead and palpate. I'm basically just palpating to see if you have any tenderness, feel any pain, sir?
No.
Okay, I'm gonna go ahead and percuss. I'm gonna percuss at the points. So using my 2 fingers. sir. Next, I'll go ahead and auscultate your lungs, sir. I will go ahead and start off with the diagram of my stethoscope first. And each time I place it on the position, you breathe in and breathe out. All right, sir?
Yes.
Ready? Go ahead. One more time. Okay. On low. Okay. Okay, right here. And then lastly, all right, sir. Now I'm gonna go ahead and inspect your posterior side. Again, I'm gonna check for any labored breathing, any movement of the back every time you breathe. Check for any inflammations, any lesions, see any hair distribution, color of the skin, any macules, skin breakdown, which I don't see any. Right, sir? I'm gonna go ahead and palpate, sir. Palpate the sides, palpate the spinal, starting with the C7, your prominence. I'm gonna go ahead and perform tactile perimeter, sir. You go ahead and say 99,
99,
99.
99, 99, 99.
Thank you. Okay, sir. Now we're gonna go ahead and percuss. We're gonna go ahead and percuss on all the points that we need to do it on. I'm gonna do it between the scapula and the spinal. Okay. Next, sir, I'm gonna go ahead and auscultate the same locations. And I'm gonna ask you to breathe in and breathe out for me. Okay, sir? Go ahead. Okay. Okay. And last one. Perfect, sir. Thank you. Breathe in, breathe out. All right, sir, I'm gonna go ahead and ask you to say some words for me. Can you say 99 while you're breathing in, breathing out?
99, 99.
Okay, very good. Can you go ahead and whisper 1, 2, 3?
1, 2, 3. 1, 2, 3.
Can you say the letter E?
E. E.
Okay, thank you. Two more. All right, thank you, sir. All right, Mr. Salinas, so to conclude our assessment, we're gonna go ahead and assess your abdomen, sir. So first, I'm gonna inspect it. I'm gonna check for any lesions, any abnormalities, check your umbilicus, if it's at the right position, any pulsations, noticing any pulsations, which typically you would see around above this area. And then after I'm inspecting for any macules, any hair distribution. You can see skin color, tan, it's very good. Okay, now sir, now we're gonna auscultate. So I'm gonna auscultate on all 4 quadrants. Starting off with the right lower quadrant, and I'm gonna go in a clockwise. Okay. When was your last bowel movement, sir?
Yesterday. At night.
Okay. Okay, and then the lower quadrant. Okay, sir. Now I'm gonna use the bell, and I'm gonna go ahead and auscultate your aortic artery, which will be located over here. Okay, I'm gonna check your left and right renal arteries, located right here. Forms like a triangle with the aortic. And lastly, I'm gonna inspect your iliac arteries, be located below the umbilicus. Okay, very good, sir. Lastly, I will go ahead and palpate. Gonna start from the right lower quadrant. First, I'm gonna start deep, light palpations, 2 centimeters. Checking for masses. Check around the abdomen area. Now I'm gonna do some deep palpation, all right, sir? I'm gonna use 2 hands. Checking for any masses, lesions. Around the area. All right, sir. Lastly, I'm gonna go ahead and percuss. I'm gonna do the same thing, percuss clockwise. Hearing tympani. All right, sir. Well, thank you very much. That is all going to be it for today's head to toe assessment, sir. Thank you so much for your time, sir.